Now, let's move on to Chapter 5, Dive Planning. If you want to enjoy a safe and fun dive in the ocean, it's not just about bringing your gear. Planning is extremely important. In this chapter, we'll learn how to prepare for a diving trip, how to anticipate and handle potential risks, the importance of buddy diving and diver safety, and how to use dive tables and dive computers. A scuba diving trip is quite different from an ordinary trip because you're entering the special environment of the ocean. That's why it's essential to plan thoroughly before you even leave. For example, you should have some knowledge of diving-related illnesses and accidents, and you should think in advance about how you would respond in an emergency. Remember, diving without a plan can turn even a small problem into a serious accident. When planning a diving trip, you should first decide the basics: where you're going, when you're going, and how many people will join. Most importantly, take into account the specific characteristics of the dive site, such as water clarity, current strength, and whether it's in a restricted area. You should also make it a habit to check your own schedule and commitments, as well as tide tables and weather forecasts in advance, especially since conditions can change suddenly. There's quite a bit to prepare before departure. First, familiarize yourself with the dive area's environment, transportation, accommodations, and the location of the dive center. Make sure you bring all necessary items: personal gear, shared equipment, tools, and medical supplies. Also prepare your diving certification card, sea card, insurance, and appropriate clothing. Lastly, check your physical condition to plan dives that won't overexert you. Right before departure, go over the plan once more with your companions and check that you've packed everything. Check the local weather again, especially sea conditions, as they can change suddenly. A final weather check is essential. It's also a good habit to share your itinerary and contact information with family or friends in case your return is delayed or you become unreachable. When you arrive at the site, the first thing to do is carefully observe the surroundings. It's also important to view the area from a high point or check the entry and exit points with a local guide. Decide on your dive buddy and go over hand signals, maximum depth, and emergency procedures together. Planning in advance how to act in an emergency will allow you to respond much faster and more accurately if a real situation occurs. Everyone, when diving, problems can occur, right? For example, your mask might come off or your regulator might come out, situations that can cause panic. In such moments, the most important thing is to stay calm. A common mistake when problems arise is moving frantically or panicking, which only makes breathing harder. The more this happens, the more difficult breathing becomes, and the worse the situation can get. So in such cases, stop first, take deep and slow breaths, and move as gently as possible. This is the key. Remember these three things: stop, breathe, think. When a problem occurs at the surface, for example, if you are floating but become exhausted or start to panic, the very first thing you must do is secure buoyancy and maintain your breathing. At the surface, this means inflating your BCD or removing your weight belt so you can stay afloat. Next, call for help, breathe slowly, and assess the situation. Your mental state is also extremely important. In a panic, you can't make any clear decisions. Calm yourself and either wait for assistance or think through how to resolve the situation. If you inhale or exhale too quickly underwater, water can enter your airway. That's why it's important to always develop the habit of breathing slowly and carefully. This is especially true when using a snorkel or when water has entered your regulator and you have expelled it. Take your first breath in gently and cautiously. In short, don't rush. Slow, steady breathing is vital for your safety. You never dive alone, right? You always have a buddy. But if your buddy starts showing strange behavior, it could be a sign that something is wrong. Here are some examples. Mask or regulator is off. Eyes are wide open or breathing is rapid. Head above the surface, flailing arms. Mask full of water with a panicked expression. No response to hand signals or speaking unclearly. It's important to recognize these signs quickly and provide help. Just remember, when rescuing, always keep your own safety in mind as well. Now, this is a more urgent situation. What should we do if our air supply is cut off underwater? Remember the steps in order. 1. If you still have some air left, make a normal ascent. 2. If your buddy is nearby, request their alternate air source, octopus, and ascend together. 3. If your buddy is too far, perform a controlled emergency swimming ascent while keeping all your gear on. 4. If all else fails, release your weight belt and make an emergency buoyant ascent. This can be a truly critical situation, so always stay close to your buddy and memorize these steps. When you are in the position of helping your buddy, if your buddy is in trouble or has had an accident, the first thing to do is release their weight belt or inflate their BCD to establish buoyancy. It's also very important to give reassurance with words like, "Are you okay?" or "Stay calm," to help them feel more stable mentally. Finally, you need to stay with them until they are safely out of the water. Lastly, the most important thing is prevention. Always dive with your buddy. Get enough rest so you're not fatigued. Avoid sudden or aggressive movements. Move slowly. Always check your remaining air. Inspect your equipment thoroughly. Be careful not to get entangled in seaweed or lines. Stay close to your buddy, and if separated, surface within the agreed time. Always make a dive plan and follow it. Stay within your limits. By doing these, you can enjoy a safe and fun dive. You should never scuba dive alone. Always dive with a buddy. Why? Because if something goes wrong, the person who can help you the fastest is the buddy right next to you. From the planning stage, decide who your buddy will be and agree on your entry point and route together. On site, check each other's equipment and agree on hand signals in advance. Another important rule in buddy diving: if your buddy says "let's stop," you stop immediately, no questions asked. That could be a sign that something is wrong. In short, always dive with your buddy, plan together, and be ready to handle emergencies together. If you lose your buddy underwater, don't panic. First, look around nearby. Then, ascend slightly and look down. You might see their air bubbles. Tap something to make noise and listen for a response. If you can't find them within 3 minutes, slowly ascend to the agreed depth and wait at the surface. Your buddy will be following the same procedure, so it's often better to reunite at the surface than to keep moving around underwater. There are many creatures living underwater. Most aren't harmful to humans, but if touched or approached too closely, they may defend themselves and attack. For example, hydroids, sea urchins, and jellyfish can sting or puncture, while barnacles and coral can cause cuts. Some species, such as sharks, sea snakes, and pufferfish, can bite or carry venom. To avoid such situations, 1. Don't get too close to marine life. 2. Always wear gloves and a wetsuit to minimize skin exposure. 3. If stung or punctured, treat with ammonia or hot water if venom is suspected, and seek medical care immediately if the condition is serious. The symptoms of an injury from marine life can vary. Usually, the skin may swell, turn red, or feel a stinging pain. However, with venomous creatures such as jellyfish, sea urchins, scorpionfish, or lionfish, more serious symptoms can occur, including muscle cramps, vomiting, shock, or paralysis. If something like jellyfish tentacles or sea urchin spines are stuck in the skin, carefully remove them first. If possible, use something like ammonia solution to help neutralize the venom. If symptoms are severe or get worse, it's important to go to the hospital for treatment. The best approach is prevention. Always wear a wetsuit and gloves to reduce skin exposure. Maintain proper neutral buoyancy so you don't accidentally touch marine life on the bottom, and, most importantly, never touch underwater creatures. When you're underwater, body heat is lost much faster than in air, about 20 to 30 times faster.
This means if you dive without a wetsuit or wear one that doesn't fit properly, your body can quickly cool down and your core temperature may drop sharply. As your temperature falls, you may start to shiver, your hands may stiffen, or your lips may turn blue. In more severe cases, your consciousness could even become impaired. That's why it's so important to always check that your wetsuit is appropriate before the dive. And if you feel cold during the dive, it's best to end it immediately. If symptoms of hypothermia appear, warm yourself with hot drinks, keep your body insulated, and whenever possible, seek medical attention right away.
Diving is an activity that consumes a lot of energy, so it's very important to maintain good health. You should keep up your basic fitness through regular exercise and get a health checkup before diving or periodically. In particular, alcohol, smoking, and drug use do not go well with diving, as they can affect your blood pressure and breathing. Never dive after drinking the day before. Diving is fun, but always remember that your physical condition comes first.
These days, the number of female divers has greatly increased. As equipment becomes lighter and smaller, women can now enjoy diving more comfortably. However, there are some precautions to keep in mind during menstruation or pregnancy. You can dive during your period, but it may be uncomfortable, and there is a potential risk of infection, so decide based on your personal condition. If you are pregnant, it's best to avoid diving. While the exact effects on the fetus are not fully known, it's recommended to refrain from diving just to be safe.
If you overexert yourself while diving, your oxygen consumption will increase and you may become short of breath. This is especially true when currents are strong, your equipment is heavy, or you're feeling tense. Overexertion doesn't just make you tired, it can cause significant stress and even lead to a loss of orientation. If you start feeling breathless or exhausted, stop immediately, take deep, steady breaths, and calm yourself. It's important to rest and remain still until you fully regained your strength.
On the other hand, very hot weather can also cause problems. If you're exposed to the sun for too long or walk a long distance carrying gear while wearing a thick wetsuit, your body temperature can rise, leading to heat stroke or heat exhaustion. Symptoms can include headache, dizziness, nausea, and, in severe cases, fainting. In such situations, remove your gear, lie down in a cool place, and drink cool water to recover. If your condition worsens, seek medical attention immediately. Open water divers aren't rescue divers yet, so you won't learn full rescue procedures at this stage. However, you should still be able to offer basic assistance if needed. For example, you and your buddies surface after a dive, only to find the boat is farther away than expected. If your buddy is too tired to swim back alone, you can't just leave them. This is when tired diver tows come in handy. First, make sure both of you have positive buoyancy by inflating your BCDs and getting your breathing under control so you can float comfortably. From there, you have a few options. Valve tow. Have your buddy lie on their back. Grab their tank valve while you lie back in the water and kick to tow them. This is the most stable and energy-efficient method. Fin push. Have your buddy lie on their back. Position yourself behind them and push forward using the fins attached to their feet. This requires more effort but allows for faster movement. Arm push. Have your buddy lie on their front with a snorkel or regulator in place. Hold under their armpits and kick while swimming forward together. Practicing these will help you stay calm and respond effectively if such a situation happens in real life. While diving, your gear can sometimes get caught in fishing lines, seaweed, or nets. This is called entanglement. If this happens, don't panic. Stay calm, locate the snag, and use a dive knife or shears to carefully cut yourself free. Another serious situation is a missing diver. If your buddy suddenly disappears, for example, you surface and they aren't there, notify your instructor or dive master immediately. If the diver's planned surfacing time has passed and they still haven't appeared, an experienced diver may conduct a search or emergency rescue services should be called. A missing diver is never a minor issue. Treat it as a critical emergency. Now let's talk about a situation many divers dread: seasickness. When the boat rocks, your vision and balance can become unsettled, making your stomach churn.
Dive boats can be especially rough, so it's worth taking precautions. Here's what you can do. Focus on the horizon or distant land. Avoid looking down into the water for long periods, as it can make the nausea worse. Stay away from engine exhaust areas. The fumes can intensify seasickness. If you're prone to motion sickness, take medication ahead of time. Remember, getting exhausted or weakened from seasickness before your dive can be dangerous, so prepare in advance and manage your condition carefully.
Now, let's talk about one of the most serious dive-related emergencies, air embolism. This is a type of lung overexpansion injury most likely to occur if you hold your breath while ascending. As you ascend, the surrounding pressure drops rapidly. If you hold your breath, the air in your lungs can expand excessively, damaging lung tissue. In severe cases, that air can enter your bloodstream. Once in the blood vessels, air bubbles can block capillaries, preventing oxygen from reaching vital organs such as the brain or heart. Symptoms can include sudden chest pain, shortness of breath, extreme fatigue, dizziness, nausea, vomiting, and even numbness or paralysis in the arms or legs. In severe cases, it can lead to loss of consciousness. The bottom line? Never hold your breath while ascending. It's one of the most dangerous mistakes a diver can make.
If someone shows symptoms of an air embolism, you must act immediately. The first priority is to administer oxygen. High-concentration oxygen helps remove nitrogen and air from the bloodstream more quickly while improving oxygen delivery to affected tissues. At the same time, arrange urgent transport to a hospital with a recompression chamber. Recompression treatment reduces the remaining gas in the body and minimizes tissue damage. And one critical rule to remember: never stop breathing while diving. When ascending, always exhale to let air escape from the lungs. Even in an emergency ascent, keep your airway open by exhaling slowly, for example, saying "ah" to prevent lung overexpansion injuries.
Now, let's look at another serious diving emergency, decompression sickness, DCS. DCS happens when a diver absorbs too much nitrogen during a dive and then ascends too quickly. Underwater, the high pressure causes more nitrogen from the breathing gas to dissolve into the body's tissues. If the ascent is too fast, that nitrogen rapidly forms bubbles in the blood and tissues, much like opening a soda bottle too quickly and seeing the fizz burst out. These nitrogen bubbles can block blood vessels, compress nerves, and damage joints. Common symptoms include joint pain, fatigue, dizziness, numbness or paralysis, chest pain, and more. In severe cases, decompression sickness can cause significant neurological injury or even be life-threatening.
If decompression sickness is suspected, the diver should immediately be given 100% oxygen. High-concentration oxygen is the most effective way to help the body eliminate nitrogen quickly. At the same time, arrange rapid transport to a recompression chamber for specialized treatment. Keeping pure oxygen available on site and having training in emergency oxygen administration is highly recommended. Courses such as FRT's Oxygen Administration and Adult and Child Emergency Care teach oxygen first aid and CPR and are strongly encouraged. A diver showing symptoms of decompression sickness must be taken to a hospital without delay. Any hesitation can make the condition worse. Now, here's the step-by-step emergency response sequence for decompression sickness. 1. Move the diver from the hazardous area to a safe location. 2. Call for rescue/help immediately. Time is critical. 3. Monitor the diver's breathing. If breathing stops or cardiac arrest occurs, begin CPR. 4. Administer 100% oxygen continuously if available. 5. Contact a hospital with a recompression chamber and arrange rapid transport. Practicing and memorizing this order will help you stay calm and respond effectively in a real situation.
Prevention is the best treatment for decompression sickness. Always follow your dive computer's guidance. Maintain a slow ascent rate and never skip the safety stop. Stay within your no decompression limit, NDL. Remember that dive computers are only theoretical models. They aren't 100% foolproof. Avoid risk factors: smoking, alcohol, fatigue, dehydration, cold exposure. Even though less than 1% of divers experience decompression sickness, just one incident can cause serious long-term effects, so caution is essential.
After diving, nitrogen can still remain in your body. Since airplane cabins have lower pressure than at sea level, flying too soon can cause nitrogen to form bubbles again, leading to decompression sickness. Wait at least 12 to 24 hours before flying after diving. If you've done repetitive or decompression dives, wait 24 hours or more. Always factor this surface interval into your travel plans to avoid risk. Scuba diving is exciting, but quick response to accidents is crucial. One major safety organization supporting divers worldwide is DAN, Divers Alert Network. Founded in 1980 in the U.S., now trusted by divers globally. Provides safety education, emergency consultation, rescue training, and 24/7 emergency hotline. Offers help such as oxygen kits, recompression chamber access, hospital referrals, and air-sea evacuation. Not just insurance, also a resource for advice and real-time emergency support. If you plan to dive long-term, knowing and possibly joining DAN can be a big safety advantage. When diving, accidents are rare but possible, so it's wise to have dedicated dive insurance. Regular travel insurance often doesn't cover diving incidents, which is why a specialized policy is important. With dive insurance, you can receive costly treatments, such as hospital care or recompression therapy, without financial worry, and even get checked for suspected symptoms to prevent conditions from worsening. You can also ask an SDI instructor about affordable and reliable coverage, making insurance preparation the first step toward being a well-prepared diver. Lastly, let's talk about rescue diver training. Unexpected problems can happen during a dive, like a buddy becoming stressed or panicking at the surface. Being able to help yourself and your buddy in these situations is essential. SDI recommends the Rescue Diver course for divers who have reached a certain skill level. This course goes beyond simply towing a distressed diver. It teaches how to stay calm under pressure, follow rescue procedures, recognize diver stress, and use emergency oxygen. Alongside this, through the FRTI, First Response Training International, you can learn CPR, first aid, bleeding control, and infection prevention. These skills are not only valuable during dives, but also in everyday life, giving you truly practical emergency responsibilities. Now, let's talk about the dive table. To understand it, the key concept is nitrogen absorption. When you're at the surface, nitrogen in your body isn't a problem. But once you start diving, the increased pressure causes more nitrogen to dissolve into your body tissues. The deeper you go and the longer you stay, the more nitrogen you absorb. After the dive, even at the surface, your body still holds more nitrogen than usual. This is called residual nitrogen. If you dive again too soon, the nitrogen from your previous dive combines with the nitrogen you absorb on the next one, increasing your risk of decompression sickness. The dive table helps manage this risk. It shows how much nitrogen remains in your body and calculates your safe, allowable bottom time for your next dive. A key term here is the no decompression limit, NDL, the maximum time you can spend at a given depth and still ascend directly to the surface without a decompression stop. If you stay within this limit, your ascent is considered safe. In this diagram, you can see divers making multiple dives. After the first dive, nitrogen builds up in the body. A safety stop and rest at the surface allows some of that nitrogen to leave your system. On the second dive, however, you're starting with leftover nitrogen from the first dive, so more is added on top of what's already there. Surface rest reduces it again, but not completely. By the third dive, residual nitrogen from earlier dives combines with the new nitrogen you absorb, leading to even greater accumulation. The more dives you make in a day, the more careful you need to be. The dive table takes this nitrogen buildup into account, helping you plan safe dives and avoid decompression sickness. In this slide, we'll go over key terms you need to understand before using the dive table. Bottom time, the time spent underwater from the start of descent until just before beginning ascent. Residual nitrogen,
the nitrogen remaining in your body from a previous dive. Repetitive group, a letter classification based on the amount of residual nitrogen used for calculations in the dive table. Repetitive dive, any dive made within a certain time after a previous dive. No decompression limit, or NDL, the maximum time you can stay at depth without making decompression stops. Safety stop, usually a 3-minute stop at 5 meters recommended to help prevent decompression sickness. Emergency decompression, extra decompression stops required if you exceed your NDL. This is a situation beginners should avoid. Knowing these terms is essential for using the dive table effectively. Here are the basic rules you must remember when using the dive table. Bottom time is measured from the start of descent to just before ascent. Even if your dive is shallower than 12 meters, the table treats it as 12 meters. If the exact depth or time isn't on the table, always choose the deeper depth and longer time for safety. Ascend slowly, no faster than 9 meters per minute. Plan conservatively for safer dives. When making multiple dives, do the deeper dive first, then the shallower one. The maximum depth for recreational diving is 40 meters. Never exceed it. Now we'll learn about the dive computer. A dive computer is a smart device that automatically does many complex calculations for us while diving. It displays important information like depth, time, ascent rate, decompression time, and no-fly time, all on one screen during and after a dive. Doing these calculations by hand would be difficult and time-consuming, but with a dive computer, it's just a few button presses. That's why many divers consider it essential gear. It usually looks like a wristwatch, and as you can see in the photo, it comes in various styles. You can simply choose the one that suits you best. A dive computer has several modes which can be grouped into 4 main types. Dive mode works underwater, showing real-time information like depth, dive time, and ascent rate. Surface mode automatically activates after you surface, calculating your surface interval time. Dive plan mode, used before diving to plan your dive, such as how deep and for how long can I go safely. Log mode, stores and displays records of your previous dives, useful for review or filling out your logbook later. No matter which model you use, these core modes are standard, so it's important to become familiar with them. Let's go over the key information you can check on a dive computer one by one. Depth shows your current depth in meters. Dive time tracks how long you've been underwater since you started your dive. Ascent rate monitors your speed when going up. Too fast can be dangerous. Decompression stop alerts you if you need to stop at a certain depth before surfacing. Surface interval, SURF-T, measures how long you've been resting out of the water between dives. No fly time tells you how long to wait before it's safe to board a plane after diving. Log data, logbook, stores all your dive details for future review. Battery status warns you when power is low so you can recharge or replace it in time. With all these details in one place, your dive computer becomes an essential partner for safe diving. Here are the key safety tips to remember when using a dive computer. Use it only for yourself. Never share it with another diver, since every person's dive profile and body condition are different. Learn how it works. Read the manual and practice using the buttons before your first dive. Stop diving if it malfunctions. If there's any error or issue, end the dive and rest for at least 24 hours. Watch your ascent rate. Follow the speed indicated on your computer to reduce decompression sickness risk. Always make a safety stop. Even without a required decompression stop, pause for about 3 minutes at 5 meters. Use it conservatively. It's based on mathematical models, not your exact physiology, so give yourself a safety margin. Protect it from shock and heat. Avoid impacts, direct sunlight, or hot water exposure. Following these habits will make your dive computer a reliable safety partner. 1. When you arrive at the dive site, what's the first thing you should do? Answer: A. Observe the site from a high vantage point. When you arrive, the first priority is to observe the site and identify environmental conditions and potential hazards. From a higher position, you can better judge entry/exit points, currents, waves, and other factors, which is essential for dive planning. 2. Which is not an essential topic to discuss with your buddy before a dive? Answer: D. Whether to take the next level of training. Pre-dive briefings should cover the purpose of the dive, communication methods, emergency procedures, and other safety-related points for the current dive. Future training plans are personal matters and not part of the essential pre-dive discussion. 3. What should you do if you become separated from your buddy during a dive? Answer: C. Search for 3 minutes, then ascend. If separated, search the immediate area for about 1 minute, scanning in all directions. If you still can't find your buddy, ascend slowly and safely to the surface to reunite. The standard rule is to search for up to 3 minutes before ascending. Performing an immediate emergency ascent is unsafe and should be avoided. 4. Which of the following would make it difficult to suspect that your buddy is having a problem? Answer: B. Maintaining neutral buoyancy. If your buddy is maintaining good neutral buoyancy, it's unlikely that there is a serious problem during the dive. On the other hand, if their mask or regulator comes off, or they suddenly ascend or descend, that could indicate trouble. Neutral buoyancy is generally a sign of a normal, stable condition. 5. Which is an inappropriate response when you run out of air underwater? Answer: D. Remove the regulator and ascend while making an "ah" sound. Even if you are out of air, you should never remove your regulator. Making a sound while ascending is an absolute last resort. Modern diving procedures prioritize using an alternate air source or your buddy's octopus. Ascending after removing the regulator without proper training is extremely dangerous. 6. Which of the following is inappropriate for safe diving? Answer: A. Diving alone in a quiet location. Unless you have completed solo diving training, you should never dive alone. The buddy system is a fundamental rule for dive safety, ensuring immediate assistance if a problem arises. Diving alone in a quiet location goes against essential safety principles. 7. Which of the following is inappropriate to decide with your buddy for safe diving? Answer: C. How to clean equipment after the dive. Before diving, you and your buddy should agree on entry and exit methods, emergency procedures, dive time and maximum depth, and hand signals, anything directly related to the dive itself. Post-dive equipment care or cleaning is a personal responsibility and not something that needs pre-dive discussion. 8. Which of the following is inappropriate for preventing injuries from marine life? Answer: C. Maintaining negative buoyancy. When diving, you should maintain neutral buoyancy to avoid damaging the underwater environment and to move carefully. Negative buoyancy increases the risk of contacting marine life or unintentionally touching the bottom, which could result in injury. 9. Which is the most appropriate first aid for hypothermia? Answer: A. Give warm drinks and keep the person insulated. When body temperature drops, it's important to restore warmth gradually. Warm drinks help raise core temperature steadily, and wrapping the person in a dry towel or blanket helps retain heat. Alcohol should be avoided as it dilates blood vessels and can further decrease body temperature. 10. Which of the following can cause heat stress or heat stroke? Answer: D. Wearing heavy equipment and traveling long distances. Heat stroke occurs when the body overheats in high-temperature environments. Carrying heavy gear over long distances increases body temperature through physical exertion, and combined with external heat, it can overwhelm the body's ability to regulate temperature. In hot conditions, limit movement distances and take frequent breaks. 11. Which of the following is an appropriate method to prevent seasickness? Answer: A. Look at the horizon or distant land. Seasickness occurs when there's a mismatch between balance signals from the inner ear and visual information. Focusing on a fixed, stable point, like the horizon or distant land, helps stabilize visual input. Looking down, focusing on nearby objects, or staying inside the cabin can make seasickness worse, so getting fresh air and looking far ahead is best. 12. Which of the following is least related to decompensation sickness? Answer B. Amount of food intake. Decompensation sickness happens when gas in the bloodstream forms bubbles after a dive. Depth, dive time, ascent rate, repetitive diving, dehydration, and flying soon after diving are direct factors. Obesity, age, and smoking can also contribute. Food intake amount, however, is not considered a significant factor. 13. What is the most important rule to prevent lung overexpansion? Answer D. Keep breathing without holding your breath. Lung overexpansion is a dangerous situation where air expands during ascent and causes damage to the lungs. To prevent this, never hold your breath and always continue breathing. Never hold your breath is a core safety rule that every diver must remember. 14. What is the standard for ascent speed in scuba diving? Answer B. Follow the dive computer's instructions. Ascending too quickly while scuba diving can cause decompression sickness, so it's important to maintain an appropriate ascent speed. The most reliable guideline is the ascent rate indicated by the dive computer, and the safest approach is to follow its alarms or warnings. 15. Which of the following is correct regarding the use of a dive computer? Answer A. Since a dive computer is calculated based on a decompression model, it can vary depending on individual characteristics, so use it conservatively. A dive computer provides decompression information based on depth and dive time. However, decompression algorithms differ depending on each person's physiological characteristics, and no device can perfectly prevent decompression sickness. Therefore, it is best to use the dive computer conservatively, such as ascending before warnings or shortening dive times. Diving isn't just about going into the water and coming back out. It's a sport that requires thorough preparation and planning. Always remember the phrase, dive the plan you made. If you go in without a plan, you'll have to react to situations on the spot, and that's far more dangerous. A key takeaway is that simple prevention can stop major accidents. Basic actions like checking your gear, confirming with your buddy, and maintaining a safe ascent rate can protect not just yourself, but your fellow divers as well. Risks usually don't appear out of nowhere. There are often warning signs. Recognizing and preparing for them leads to much safer dives. For example, if you feel fatigued, skipping a dive is a smart decision. Always monitor your physical condition and never attempt a dive beyond your experience level. If your deepest dive so far is 18 meters, you shouldn't suddenly attempt 30 meters. Finally, continuing your education is crucial. Becoming an open water diver is not the end. Advancing through advanced, specialty, and rescue diver courses will make you safer and allow you to explore a much wider world. So remember today's lesson. Always dive safely and according to your plan. That's the first step to truly enjoyable diving. Do you have any questions about what we covered today? If there's anything you didn't fully understand or would like to know more about, feel free to ask anytime.